So in this module, I wanted to talk about the embryo transfer procedure when a surrogate is involved. Now, many of you might have experience with your own embryo transfers, so this chapter might be a recap, but it might be refreshing for you to know that there's essentially no difference in an embryo transfer, whether or not it's a surrogate or for an intended mother. But for those of you who have never done a frozen embryo transfer before or don't even know what it is, in this module, I'm going to briefly talk about essentially what all the steps are. So first, there are two ways to do a frozen embryo transfer. You can do it naturally, which we'll call the natural cycle, or you can do a hormone replacement therapy cycle, which is the most popular way of doing it. So in a natural cycle, as the name implies, things are going to be a little bit more natural, more in line with the surrogate's own cycle. So the surrogate's endometrium thickens naturally as part of her normal cycle, and follicles are going to be monitored, and then ovulation is going to be triggered, and then 1 week later, the embryo transfer is going to take place. With a hormone replacement therapy, things are a little more scheduled according to the fertility clinic schedule. And so here, injections are going to be given to the surrogate in order to control her reproductive cycle. And once a period arrives, so once the fertility clinic has decided that it's time for an embryo transfer, they're going to wait for a period to arrive, and then the surrogate is going to take estrogen and progesterone medication as a way to thicken up her endometrium lining. Essentially, the goal of either of these two methods is to thicken up the surrogate's endometrium lining so that it is thick enough to have an embryo be implanted. However, no matter the method, whether it's done naturally or with hormone replacements, the surrogate is going to have to start doing these progesterone-in-oil shots. Now, these are serious shots. These are intramuscular shots that go somewhere in the backside, like the picture suggests, or if the surrogate prefers, in her thighs. So these shots, these PIO shots, are going to start 5 days before the scheduled embryo transfer, and the surrogate is going to have to continue taking them the entire first trimester. So this is the same as if you're doing a frozen embryo transfer on yourself. If you're an intended mother, you would also have to take these shots for the entire first trimester. So basically, the progesterone-in-oil shots have been shown to help with pregnancy rates. And these PIO shots are prescribed until the placenta forms, and then it establishes its own blood supply between the placenta and the fetus. And then comes the embryo transfer day. So embryo transfer day is actually scheduled by the fertility clinic about a month before. And so this day may change a day or two, but in general, especially if the surrogate is doing a hormone replacement therapy cycle, you will know this date about a month before, and everything will try to be scheduled. The medicine will be prescribed in such a way that hopefully the surrogate's uterine lining is thick enough by the embryo transfer day. So the actual transfer itself is relatively painless. The only thing is that the surrogate is going to be asked to have a full bladder, which might make the procedure a little bit uncomfortable, but it should not be painful. A catheter is going to be used to place the embryo into the surrogate's uterus, so the fertility doctor is going to know the right spot to put the embryo. And that's basically it. And so when the catheter is injected, it's very small and it shouldn't cause any pain. And this whole thing takes about 15 minutes. And it's a lot of the 15 minutes is setting up the safety precautions. And after that, the surrogate is going to be advised to take it easy for the rest of the day. So being overly cautious, they might ask the surrogate to just lay down for the rest of the day, but there are no studies showing that any moderate activity will hurt your chances. So as we've been talking about in the other lessons in this chapter, a lot has to be done before you get to this point. You have to if you're an intended parent, you have to create your embryos. Then you have to find a surrogate, or a surrogate needs to find intended parents. Then you need to get medically cleared. Then you need to get legally cleared, and then you got to schedule the embryo transfer with the fertility clinic. So all of this takes so much time. Patience is a virtue, especially in the surrogacy journey. So by the time you get to this point, no matter what happens in the future, this day is a day of celebration. Before getting to the next point in the journey, which is, did the surrogate get pregnant with this embryo transfer? There's about 10 to 14 days where both parties are going to have to wait for this HCG test. Many surrogates start taking at-home pregnancy test pretty much maybe 4 or 5 days after the transfer, just to see if they can see a little line, a squinter. So depending on if you're a surrogate, your views on, or if you're an intended parent and you just kind of want to wait the 2 weeks, there's a lot of variation here. And I've seen both ways. You might be wondering, what are the chances that a surrogate will get pregnant the first time around? Well, according to the CDC, surrogates get pregnant the first time around more often than non-surrogates. So in this graph right here, if the intended mother or the donor is less than 35 years old, then the surrogate will get pregnant the first time about 54% of the time versus 45%. So this is a pretty big difference. And then you can see as the ages increase, this rate decreases, but that's normal in the fertility world. Eggs decrease in quality as the women get older. You might also wonder if your pregnancy rate or your pregnancy likelihood also depends on the type of clinic you're at. And the answer is yes. Clinics do vary in their implantation and pregnancy rate success. So most of the time, this variation is explained by the patient type. So certain clinics specialize in certain patient types. So some patients are harder to treat. So some clinics might decide that these are the patients that we want to focus on. Whereas some other clinics might decide that they want an easier to treat patient in their patient pool. So a lot of these variations that you see across different clinic types about how many of their patients get pregnant the first time around depends a lot on the type of patient that is visiting the clinic. So this is an important question that if you're an intended parent, you might want to ask your clinic. So chances are that if your clinic is a SART member, so Society of Assisted Reproductive and Technology member, you can find their results online. And I'll have another module kind of clicking through and showing exactly how to use their website. But their website is very nice because it does provide very detailed statistics depending on age group, whether or not the embryo was a 5-day embryo, whether or not the embryo was PGT, normal, things like this. So the website provides some very interesting detailed statistics. However, when you're looking at it and you're trying to assess the overall quality of your clinic, the best rates to use are the retrieval start report rate, that's going to be on the report starting from 2016, and the fresh donor egg birth rate. So these are the two most telling statistics of the quality of your clinic. And if your clinic is not a SART member, you can check out the CDC website. They may have some additional statistics on clinics if your clinic is not a SART member.